Out of these press conferences, just to give the context, I think that's really important. We need to remember the difference that we are in Australia compared with the rest of the world. So in the last 24 hours, across the world, 697,000 cases, recognising that in many countries we don't know how many cases there are, but they're the ones that are recorded officially, and almost 11,000 deaths in the world in the last 24 hours. The situation here in Australia, again, a day of no community transmission and no deaths, a 00 day. So that's where we are. Since the start of the year, we've had 62 days, that's 61% of the days in this year, where there has been no community transmission. And it's been 9 days since we had a community transmitted case in the community. So that's where we are. And what does that lead to? It leads to Australia essentially being open. As of today, Victoria is open to every other state. WA still has some restrictions in relation to Queensland, but by next week, assuming everything stays as it is now, they will be open. We can go to the footy. Many places around the world you can't do that. So people are allowed to go about their business pretty much back to pre-COVID times. And that is because of the public health response we've had here in Australia since the beginning of the pandemic, taking into account new information, taking that into our planning and our response, and being nimble when things change. And so what's happened over the last few days, people have certainly heard about the safety concerns that were expressed by the medical expert group, ATAGI, the vaccine, the immunisation guiding group for the Minister for Health, who have alerted us, the Australian Government and the AHPPC that I chair, about this matter with these extremely rare but serious issues of blood clots. And just to be very clear, I was talking to my colleague here about this just now, about the clotting. This is a very specific clotting. This is a brand new disease in relation to this matter. So these are not the usual blood clots that are very common that we get in our legs or in our lungs. These are particular types of blood clots, almost certainly related to an immunological response to the vaccine itself. And so very rare, somewhere around 4 to 6 per million, but can be quite serious. And so that is why that advice last week about AstraZeneca, particularly in the under 50s, that there was a preference that another vaccine should be used other than AstraZeneca. And so that was the information that was given to us by that expert group on Thursday around 7 p.m. Within 15 minutes, the Prime Minister, myself, Professor Murphy and Health Minister Hunt were talking about that with the Australian public, giving that information. Since then, even that evening, we gave information out to doctors and other vaccine providers in the community so that they were able to have that very important and detailed discussion with their patients, balancing that risk and benefit equation between the vaccine on one hand and prevention of the seriousness of COVID disease on the other. And that is something that's not unusual. That is what doctors do every day in relation to all vaccines, all medicines, all medical procedures. None of these things are without their risk. This is just another thing to consider and to take into that conversation. In the meantime, the vaccine continues to roll out. As of Friday, we reached our 1 millionth dose. And so, as of yesterday, 1,178,302 vaccines have been distributed around Australia, including 473,000 in primary care, 142,000 in aged care, and through our state and territory partners, almost 561,000. Yesterday there was a daily increase of 12,227. That was a Sunday number, so you wouldn't expect that to be large. But in previous days before that, they were much higher. We'll be looking very closely and carefully about what influence that AstraZeneca announcement will make in relation to those numbers through the week. But Anecdotally, at least, we know that many of our GP colleagues, and particularly the GP respiratory clinics that we have a direct relationship with in the Commonwealth, have seen some people cancel their appointments, but a very small number over the weekend, very small number, and there is certainly a lot of people still wanting to get that vaccine. My main message, so we are now looking to recalibrate in relation to that, to the vaccine rollout on the basis of this new information. But in the meantime, my message to all Australians is, please, if you are in that 1A or 1B priority group, continue to roll up to your vaccine provider, roll up your sleeves and get the jab. Make sure that if you have concerns about a particular vaccine or any of the procedures, as would normally be the case, please discuss that with your normal GP or the vaccine provider that you're going to. Work through those issues with them and come to that agreement in an informed way, including in relation to this new information that came through last week. So I think with that, I'll leave it and I'll start with questions in the room.
Just on the subject of the Moderna vaccine, has the issue of indemnity been a sticking point in those negotiations? Is that the reason why we haven't been able to close a deal with Moderna?
So Moderna has an mRNA vaccine, the same, very similar, in fact, virtually the same as the Pfizer vaccine. Just in relation to this, and we've said it many times, but I'll say it again, we have a specific advisory group, the Scientific Industry Technical Advisory Group, which advises us. Professor Murphy's the chair, I'm the deputy chair. We work through all of the potential options for what vaccines Australia should pre-purchase last year, through last year. We decided to go for one mRNA vaccine over the other. We felt that Pfizer was the better alternative there. We had 2 protein vaccines and 1 viral vector vaccine, so they're the 4, plus the COVAX initiative. We continue to talk to Moderna, of course we do, and in relation to what might be stopping Moderna coming here, I think there's commercial and confidence issues I won't talk about, but in general they remain on the table as an option. I will say, though, that unlike other vaccines, for example, the Janssen or Johnson & Johnson vaccine, Novavax, Pfizer and AstraZeneca, no other vaccines of the many different vaccines in development have come to the TGA with their asking to be go through that regulatory process. So Moderna has not asked for that yet.
Just on that task force recommendation for Pfizer over Moderna, similar sort of type of vaccine. Last week Professor Murphy was making comments on this as well, saying Moderna hasn't delivered that much vaccine yet. It's a relatively young company. That's one of the reasons why we went for Pfizer. But looking at the US at the moment, Moderna is making a lot of vaccines right now. It's responsible for almost half the US vaccination issue so far. Seems to be a very good vaccine. Did the group get it wrong?
So we used the information that we had at the time, and at that time, Moderna was a small company. It was just starting up. Looked like a very good prospect otherwise, and but in many ways very similar to Pfizer. And we've worked with Pfizer over many years with other vaccines and other medical products, and so large company, and as it's turned out, been very reliable in giving their vaccine supply. So nothing against Moderna. It was tossing up one or the other, and we needed to have at least one of those types of vaccines. So we went from there.
Professor Kelly, on current projections, how long will it be before the majority, or all Australians, have their first jab of a vaccine? And on the current projections that are put before you and the speed of the rollout, how many Australians will be vaccinated by the end of the year?
So we're continuing with our two elements of our vaccine rollout. One is actually to vaccinate the people that are most at risk, the most vulnerable, and we've talked about that many times. Phase 1, 1A and 1B, so the quarantine workers and other border workers, we understand from our state colleagues that that's pretty much done. In some states a bit less than others, but mostly that's very close to being completed. Who else is in 1A? The aged care residents, they're a very important component the most vulnerable members of our community. That's a Commonwealth responsibility. We're going out and doing that. That's going very well, and we plan to have that completed within the next few weeks, at least the first dose. And then we have healthcare workers and aged care workers, disability care and disability care workers. And so that those are our priority populations. By the middle of the year, we are wanting to get those completed. The rest, with this new information that we have over the last few days, of course, we need to recalibrate what we're doing in relation to the vaccine program. So I'm not going to give a number or a date for that, but we are absolutely committed to providing the vaccine to any adult Australian who wants to have that vaccine as quickly as possible. So that's what we'll be doing.
Though, because I'm not asking for a target. I'm asking you what the taxpayer-funded projections tell you. So what do the taxpayer-funded projections tell you about how long it will be before all Australians have at least one jab?
So we're continuing to put that out, and we've had a big change in relation to the logistics and the rollout in terms of the announcement on AstraZeneca last week. So we will take our time to work through that.
But do you have any information before you? I mean, do you get regular projections?
So we're working through those logistic challenges, and we'll just continue to do that. I'm not going to be led into giving a number.
And how do you think we compare internationally? The Financial Times, originally we were told we'd be the front of the queue. The Financial Times, which is regarded by the government as the more authoritative information, says that we're 76 out of 152 countries. We're behind Indonesia. We're behind a whole range of countries in our region. Why are we 76 out of 152 when we were told we were going to be at the front of the queue? Well,
I'm not going to go through the details of every particular country. I'm not aware of that particular league table by the Financial Review or how they've come to that. Financial Times, okay.
It's a very well-known, you would have seen the graphics.
Yeah, so what I can say is that many countries started earlier than us, and we know all the reasons for that. We've been cautious in having safety as our first priority. And look what's happened over the last week. We only know about this very rare side effect with AstraZeneca because there have been millions of doses elsewhere. So there's some advantage to not being at the top of that league table. But if you look at a better statistic is to look at where we are in relation to the start of a program rather than where people are where they started months or before us. And we're not that far away from the majority. That's all I would say. Is there anyone else? No. I'll just go to the phone. Tansen's on the line from Herald Sun.
Thanks, Professor. I was just wondering how many doses of Pfizer that Australia has received so far and how many we're receiving on average per week. And if you won't give us that number, what's the reason behind not sharing those details?
So what I can say about Pfizer is that we have had a regular supply since the middle of February. And it started a little bit lower and it's now gone up to over 100,000 per week. It's come every week, as Pfizer has promised to do. We continue to talk to them about increasing the rate of that, given that they have guaranteed on our first part of our contract with them to supply 20 million by the end of the year. And as was announced on Friday, another 20 million, which will be at the back end of the year. So that they will need to increase the numbers that they're giving us, and we're in negotiations for them to do that on a weekly basis. What happens when that comes in? There's a very brief check by the TGA, which is an important element of our quality assurance, and particularly to make sure that the cold chain process has been done properly in transit. And then there is a calculation made, which is very important in relation to Pfizer, as there are 2 doses and they should be 3 weeks apart, that there is a contingency. So for every dose that is distributed, there is always a second dose kept in reserve. All the rest, absolutely all of the rest of the doses are going out to be used. And at the moment, up until now, it's been mostly either in the aged care rollout in residential aged care, or through the states and territories into their clinics for their healthcare workers and their their quarantine and border workers. So, that's what it is. Australians don't. Everyone needs to be reassured that all those doses are being used, and the supply is the thing that is constraining us from going faster. So I've got Madura from the Courier Mail.
Just Professor, just to continue on from that, how many doses of Pfizer has Australia received so far?
Yeah, I don't have that with me at the moment. Madura?
But, sorry, will you take that question on notice?
Yeah, I can take.
Us with a response?
I will take it on notice. Yes, Madura.
Thank you.
Thanks, Professor. You mentioned, of course, recalibrating Australia's vaccine rollout due to the decision around AstraZeneca. Can you, I guess, expand on what exactly that means when you say recalibrate the vaccine rollout? And also, when it comes to that, like, is there modelling on, how many AstraZeneca doses, I guess, perhaps might be rejected by people under the age of 50, where that's going to go, and how much more Pfizer or other vaccines might be needed to be able to handle that population, and also if there's any modelling happening as to what slice of the population might reject the AstraZeneca vaccine due to this decision.
I think the short answer to that is yes, there is modelling underway for all of the things you've mentioned. I don't have any of the results of that modelling, but all of those things are important considerations, and that's exactly what we mean by recalibrating. With new information, we're being nimble to consider what that might mean in terms of the rollout, making sure that is done safely, that it's done clearly, and all of our partners that are involved with that rollout and the Australian public understand how that will all work. But I don't have any information there yet. This has happened over the weekend and will continue this week. Natasha.
Is it your expectation that this modelling will be made public?
I'm not in a position to talk about that at the moment. Natasha, from the Australian.
Thank you very much. Yes, in relation to healthcare workers aged under 50, do you have an estimate of how many people fall into that bracket? And are we going to have enough Pfizer available up until sort of the mid-year to vaccinate all those people? And a second question in relation to Moderna and Johnson & Johnson, is it correct that those companies won't sell vaccine to Australia on the basis that we don't have a no-fault vaccine compensation scheme?
So there's a couple of issues there. One is about the numbers. What I can say is that we will have 40 million doses of Pfizer by the end of the year, and so by the end of the year we will definitely have enough to vaccinate basically the entire adult population of Australia. But in the meantime...
Sorry, I was talking about the healthcare workers aged under 50, the Pfizer available by mid-year.
Yeah, so it goes back to the answer of my previous question that we will by the end of the year have, by our contract with Pfizer, 40 million doses of Pfizer. Can I tell you on a week-by-week basis how much that is coming in or how much will be here by the middle of the year? No, I can't. So I can't answer that question. And the second part, sorry, what was the other part? Oh, the no-fault compensation scheme. Look, no-fault compensation schemes are available in many other countries in the world. And really that's a matter for government policy to consider whether Australia should be considering that, and I'm not going to comment further on Australia's response. But what I can say is, and this was reinforced by Minister Hunt yesterday, backed up by the AMA and by the RACGP over the weekend, that in terms of indemnity insurance for providers, GPs and other vaccine providers, but particularly GPs, that's covered, and it's covered also in our contracts with Pfizer and with AstraZeneca in relation to indemnity. So those components are not an issue for Australia right now.
Picking up on Natasha's question, though, I mean, isn't what she's asking is you're going to have a group of frontline workers that might not be able to be vaccinated until later this year. That's way out of whack with the original plan. And just on this, I mean, I know this is anecdotal, but this is a gentleman who said on social media today in relation, he's in 1B, presumably some sort of chronic illness. He said, Paul Kelly on Radio National right now says 1B rollout, quote, largely unaffected, My partner and I are in 1B. Last week we could get a vaccine appointment. This morning we can't, and we won't be able to get until the Pfizer shipment arrives at the end of the year. Is that accurate?
No, that's not accurate.
Last question.
Last question from Emily White and 9 News.
Thanks, Professor. The Victorian government is wanting its supply of AstraZeneca diverted to GP clinics for the next 2 weeks. Is that something that you will endorse?
So we've been in close contact with all of our state and territory partners over the weekend about this recalibration exercise. They've given us a range of suggestions that we're working through with them right now. Part of that recalibration will almost certainly be a rebalancing of where the vaccines are and where they're available. But these are ongoing discussions, and I can't really say much more at the moment. But it's a very good point you've made. There will be a need to look at all of those things. And just to reiterate my previous answer about the vulnerable groups, including our healthcare workers, we are continuing with our aim to have them all vaccinated by the middle of the year. As Norman Swan said this morning, winter is coming, and we know that winter is an important component of all respiratory viruses. And so those that are most vulnerable and those that are most likely to be exposed to the virus will be need to be protected by that time. And I'll go right back to the beginning of this press conference, where I've said for 62 days this year we've had not a single community case in Australia. And so for most healthcare workers, it is not a risk at the moment until such time as we get an outbreak. And that is something we need to protect them against before that happens. Okay, thanks everyone.
Some GPs, are saying that their clinics are too small to ramp up vaccine numbers, so they're attempting to join forces with other local clinics. Is that something that's within the rules and would you support it?
No comment.
Professor has exited the building.